Hey guys, today I'm going to be discussing understanding your opioid prescription, specifically effective strategies for understanding your opioid prescription relating to long-term effects for orthopedic surgery patients. So first off, this is a quick overview of what this presentation is going to provide. We're going to go over the purpose and the audience, a little bit of background on the opioid crisis, the methods of how this paper was written, the completed work I have done, an overview of the results and findings, and the things to be done before submission is going to occur. First of all, the purpose and the audience. The purpose is to outline the issues of opioid use after orthopedic surgery to make these patients more aware of potential addiction and long-term effects associated with the drug. And purposefully, orthopedic surgery patients at UK Chandler Hospital are going to be targeted because this population is at a very high risk for addiction after their surgery. So this is a quick little infographic of the opioid epidemic by numbers. And as you can see, this is an increase that we are seeing in the United States. So there are 130 plus people who die from opioid-related drug overdoses, and there's 10.3 million people who misuse prescription opioids. This can be seen in this population, specifically in Kentucky, as so many people are turning to heroin after they have misused their opioid prescriptions. A lot of this has to do with the lack of education people get on these opioid drugs, but it also has to do with the lack of health care that they're provided in different parts of the state. So a little bit of background on the opioid crisis. Like I said before, patients have very little education on their opioid prescriptions. If they're not educated on opioid addiction beforehand, the only education they get about their prescription is a little speech from the doctor and a speech from the pharmacist on how to use their drug. Orthopedic surgery patients actually rank third highest in opioid prescriptions post-operatively, which is why this population is targeted for this paper. And as we saw in that infographic, dependence continues to grow, increasing in surgery patients 152%. And so, since we're not seeing a change in the amount of opioid drugs that are being prescribed, I think it is very important that we educate these patients so that they can make a choice that's best for them and speak to their physician before they take these drugs and potentially go down a path of addiction that is very hard to get out of. So for this paper, the following methods were followed. I researched opioid use and the abuse within the United States, which I discussed. I pulled the relevant information about opioid use specifically to orthopedic surgery when I was reading through these papers. I subsectioned the report into post-operative opioid users and pre-operative non-opioid users. I did this because I saw that the addiction potential for opioid users prior to surgery and non-opioid users prior to surgery was very different, and in order to meet my audience needs, there needed to be two subsections of the paper. I identified necessary pharmaceutical information related to different opioid use with scientific studies. So within these scientific studies, I made sure that appropriate information was pulled so the audience wasn't too overwhelmed, but could also understand the addiction potential and the mechanism behind the opioid drugs. And then I compiled all this information into an information report specifically to orthopedic surgery patients prior to surgery. So far, I've completed all the research for my project. I'm very confident about the background information I have provided, and I think the patients will find this information very helpful when they're trying to get a better understanding of why they should be warned about their opioid drug prescription. I'm also confident about my suggestions and findings. I feel that my suggestions and findings relate to the two different patient populations that I talked about very well. These patients can go specifically to the category they fall into to make sure that their needs are met. I also feel like my discussion is very complete and offers the patients the good understanding of alternatives and what to watch for when taking an opioid drug. So just a quick overview. I found that preoperative opioid users differ in addiction potential compared to naive users, which is why I split the paper into two different populations. A patient's perception of pain relief prior to surgery actually greatly affects their chances of misusing their opioid prescription. So this is something I actually found within my research that I thought was important to provide in the paper. If a patient goes into surgery expecting there to be no pain, they're going to be much more likely to use their opioid drug. But if they're counseled into understanding that they will feel some pain, but that pain is only temporary, they're going to be less likely to use that opioid drug and potentially not get addicted down the line. I also found that there's a lot of alternatives that patients can use in order to not use opioid drugs. NSAIDs, for example, like down here in the corner, I have Motrin, Advil, and Aleve. Those are all non-addictive drugs that patients can use as an alternative for their opioid drug. Corticosteroids is also an option, and this can be given prior to surgery to relax those pain receptors so that they're not as likely to be in severe pain after their operation. And then a TINS unit is something that can be used for a patient in specific locations of pain to try and numb that. Ideally, all three of these would be used in combination in order for the patient to avoid opioid drug prescription altogether. So before I submit this paper, I would like to finalize my method section. I would like to pull some more information specifically to orthopedic surgery patients and why I chose that population. I would also like to target some specific surgeries for this report to narrow my audience even more, to be more to specific orthopedic surgeries. I would also like to incorporate more information directly relating to orthopedic surgery patients. So right now, this report could be used for all different types of opioid prescription users, but if I could narrow it down to orthopedic surgery patients specifically, I think my audience would benefit. I need to also look into the organization of my report. I talked about some subheadings, but in order to execute that successfully, I'm going to go back through and make sure the information provided in all of my sections is appropriate. And before submission, I'm going to read and edit my final report and potentially submit it to the Writing Center to make sure it's the best it can be before final submission. Here's my works cited. Thank you so much for listening. I hope you enjoyed this report, and I hope you have learned something about opioid addiction prior to surgery. Thank you.